In part 1, we saw the various types of blood components and their respective functions in the body. In this second part, we shall discuss the production of blood cells and various disorders associated with blood components in the body. The clinical aspects of blood components shall also be discussed as well as its treatment aspects. We shall also briefly see the types of blood groups in human beings. Hemophilia is the production of the formed elements of blood. Hemopoietic tissues refer to the tissues that produce blood. The earliest hemopoietic tissue that develops is the yolk sac, which also functions in the transfer of yolk nutrients of the embryo. In the fetus, blood cells are produced by bone marrow, liver, spleen and thymus. This changes during and after birth. The liver stops producing blood cells around the time of birth, while the spleen stops producing them soon after birth but continues to produce lymphocytes for life. From infancy onwards, all formed elements are produced in the red bone marrow. Lymphocytes are additionally produced in lymphoid tissues and organs widely distributed in the body, including the thymus, tonsils, lymphoid nodes, spleen and patches of lymphoid tissues in the intestine. Erythropoiesis refers specially to the production of erythrocytes or red blood cells. These are formed through the sequence of cell transformations. The pro-erythroblast has receptors for the hormone erythropoietin. Once erythropoietin receptors are in place, the cell is committed to exclusively produce RBCs. The erythroblasts then multiply and synthesize hemoglobin, which is a red oxygen transport protein. The nucleus from the erythroblast is then discarded, giving rise to cells named reticulocytes. The overall transformation from hemocytoblast to reticulocytes involves a reduction in cell size, an increase in cell number, the synthesis of hemoglobin and the loss of cell nucleus. These reticulocytes leave the bone marrow and enter the bloodstream, where they mature into erythrocytes when their endoplasmic reticulum disappears. Leukopoiesis refers to the production of leukocytes. It begins when some types of hemocytoblasts differentiate into three types of committed cells: B progenitors, which are destined to become B lymphocyte, T progenitors, which become T lymphocytes, granulocytes, the macrophage colony forming units, which become granulocytes and monocytes. These cells have receptors for colony stimulating factors. Each colony stimulating factors stimulate different WBC types to develop in response to specific needs. Mature lymphocytes and macrophages secrete several types of CSFs in response to infections and other immune challenges. The red bone marrow stores granulocytes and monocytes until they are needed in the bloodstream. However, circulating leukocytes do not stay in the blood for very long. Granulocytes circulate for 4 to 8 hours and then migrate into the tissues where they live for another 4 to 5 days. Monocytes travel in the blood for 10 to 20 hours, then migrate into the tissues and transform into a variety of macrophages which can live as long as few years. Lymphocytes are responsible for long-term immunity and can survive from a few weeks to decades. They are continually recycled from blood to tissue fluid to lymph and finally back to the blood. Thrombopoiesis refers to the production of platelets in the blood because platelets used to be called thrombocytes. This starts when a hemocytoblast develops receptors for hormone thrombopoietin, which is produced by liver and kidneys. When these receptors are in place, the hemocytoblast becomes a committed cell called a megakaryoblast. This replicates its DNA, producing a large cell called megakaryocyte, which breaks up into tiny fragments that enter the bloodstream as platelets. About 25 to 40% of the platelets are stored in the spleen and released as needed. The remainder circulate freely in the blood and live for about 10 days. The term hematology refers to the diagnosis, treatment and prevention of blood and bone marrow diseases, as well as immunologic, blood clotting and vascular systems. A doctor who specialized in hematology is called a hematologist. Now let us see some of the disorders and diseases associated with blood components. Glucosuria. Blood plasma transports glucose to the various tissues of the body from intestine. So, glucose is present in blood. The normal glucose level in the blood is 180 mg per 100 ml of blood. If the level of glucose is above the normal value, it passes out along with urine, a condition called Glucosuria. Uremia. Uremia, produced as a catabolic waste product of amino acids, has a normal range of 17 to 30 mg per 100 ml of blood. During renal or cardiac disorders, elimination of urea may be reduced. This increases the concentration of urea in blood, a condition known as uremia. Haemolysis. The disruption of RBCs with the escape of hemoglobin from the corpuscles to the plasma is called haemolysis. It occurs when RBCs are in hypotonic medium. Anemia. It is a disorder where decrease in the number of RBCs result, causing reduction in hemoglobin content of blood. It might also occur due to either excessive blood loss or increased destruction of RBC by hemolysis. Generally, the normal hemoglobin range is 12 to 15 gram per dl in adult females, while 13.5 to 17 gram per dl in adult males. Individuals with hemoglobin value below this normal range are considered anemic and have low iron content. Chronic anemia. People with chronic kidney disease or other chronic diseases tend to develop chronic anemia. This disease does not usually require treatment. Injections of a synthetic hormone, epoetin alpha, to stimulate the production of blood cells or blood transfusions may be necessary in some people with this form of anemia. Pernicious anemia or B12 deficiency. It is a condition that prevents the body from absorbing enough B12 in the diet. This can be caused by weakened stomach lining or an autoimmune condition. High doses of vitamin B12 prevent long-term problems. Aplastic anemia. In this condition, the bone marrow does not produce enough blood cells. A viral infection, drug side effect or an autoimmune condition can cause aplastic anemia. medications, blood transfusions, and even a bone marrow transplant may be required to treat aplastic anemia. Thalassemia. This is a genetic form of anemia that mostly affects people of Mediterranean heritage. The amount of hemoglobin is less than normal, resulting in fewer healthy RBC, and the person becomes anemic. Symptoms include fatigue, jaundice, pale skin, and protruding abdomen. Most people have no symptoms and require no treatment. Others may need regular blood transfusions to relieve anemia symptoms. Sickle cell anemia, a genetic condition that affects mostly people whose families have come from Africa, South or Central America, India, etc. This is a genetic disease where the hemoglobin molecules distort the RBC. The red blood cells become sickle shaped, sticky, stiff, and blocks the blood flow. Lymphoma. It is a form of blood cancer that develops in the lymph system where white blood cell becomes malignant, multiply and spread abnormally. Hodgkin lymphoma and non-Hodgkin's lymphoma are the two major groups of lymphoma. Treatment with chemotherapy and or radiation can often extend life with lymphoma and sometimes cure it. Leukemia. It is also a form of blood cancer in which a WBC becomes malignant and multiplies inside bone marrow. Leukemia may be acute or chronic. Chemotherapy and or stem cell transplantation can be used to treat leukemia. Multiple myeloma. In this condition, the WBCs become malignant. The plasma cells multiply and release damaging substances that eventually cause organ damage. It has no cure, but stem cell transplant and or chemotherapy can allow people to live for years with the condition. Hemophilia, a genetic deficiency of proteins that help blood to clot. There are multiple forms of hemophilia ranging in severity from mild to life-threatening. Von Willebrand disease. Von Willebrand factor is a protein in blood that helps blood to clot. In von Willebrand disease, the body either produces too little of the protein or produces a protein that doesn't work well. Deep venous thrombosis. It is usually a blood clot in a deep vein, mostly in the leg. A deep venous thrombosis can dislodge and travel through the heart to the lungs, causing a pulmonary embolism. In the condition where the number of RBCs decrease in blood, it is called erythrocytopenia, while when the number of RBCs increase in blood, it is called erythrocytosis. When the number of leukocytes are above 11,000 per cubic millimeter, the condition is known as leukocytosis. Severe increase in WBCs occur during cancer, which is called leukemia. When the count of WBCs are less than the normal value, it is known as leukopenia. Sharp decrease in the number of platelets is known as thrombopenia, while excess is called thrombocytosis. Idiopathic thrombocytopenic purpura. It is a condition causing a persistently low number of platelets in the blood due to an unknown cause. Usually, there are no symptoms, yet abnormal bruising or small red spots in the skin or abnormal bleeding are seen. Thrombotic thrombocytopenic purpura, a rare blood disorder causing small blood clots to form in blood vessels throughout the body. The platelets are used up in the process, causing a low platelet count. Diagnosis of various blood parameters helps in assessing the condition of a diseased person. Some of them are packed cell volume (PCV) or hematocrit. It is the total cell volume of the blood in the body. It is normally 45% for men and 40% for women. A decreased PCV generally means red blood cell loss from any variety of reasons like cell destruction, blood loss and failure of bone marrow production. An increased PCV generally means dehydration or an abnormal increase in RBC production. It helps in detecting anemia or polycythemia. Both are potentially life-threatening disorders. Erythrocyte sedimentation rate. The rate of sedimentation of RBCs is known as ESR. It helps in the diagnosis of many diseases. The ESR is decreased in polycythemia, hyperviscosity, sickle cell anemia, leukemia, low plasma protein due to liver or kidney disease and congenitive heart failure. The basal ESR is slightly higher in females. Red blood cell count. This tests find out how many RBCs we have in our blood and help in diagnosis of diseases. The RBC count is higher than normal during cigarette smoking, congenital heart disease, dehydration, renal cell carcinoma, pulmonary fibrosis and polycythemia vera. The count is lower than normal during anemia, bone marrow failure, erythropoietin deficiency, haemolysis, malnutrition, multiple myeloma, nutritional deficiencies and pregnancy. White blood cell count. A WBC count can detect hidden infections and undiagnosed medical conditions within body such as autoimmune diseases, immune deficiencies and blood disorders. A high WBC count may be due to infections, inflammation, leukemia, myeloproliferative neoplasms, allergic responses, etc. A low WBC count may be due to bone marrow damage or disorders, lymphoma, dietary deficiencies and diseases of the immune system. Platelet count. It helps to find out various disorders associated with thrombocytosis and thrombocytopenia. Complete blood cell test. A CBC test measures the number of all types of components in the blood including RBCs, WBCs, hemoglobin, hematocrit and platelets which help in diagnosis of many diseases. Blood for transfusion is obtained from human donors by blood donation stored in blood bank. There are different blood types in humans belonging to ABO blood group and rhesus blood group. Transfusion of incompatible blood group may cause severe, often fatal complications. So, cross-matching is done to ensure that a compatible blood product is transfused. Other blood products administered intravenously are platelets, blood plasma, cryoprecipitate and specific coagulation factor concentrates. In emergency situations, a plasma expander is a more effective life-saving procedure than a blood transfusion because the metabolism of transfused RBC does not restart immediately after a transfusion. Human serum albumin of fresh frozen plasma are also used as plasma expanders. In 1900, Karl Landsteiner discovered the existence of 3 blood groups in human beings, for which he received the Nobel Prize in 1931. The 4th blood group was discovered by De Castello and Sterli in 1902. Landsteiner demonstrated the presence of two chief factors in human blood which are responsible for the agglutination. These two factors are named as agglutinogen or antigens present in RBC and agglutinin or antibodies present in blood serum. In human blood, two types of agglutinogens, namely A and B, exist in the erythrocyte. A person may have either A or B or both A and B or may be absent. Antibodies may be either anti-A and anti-B. Blood never contains antigen A with antibody A and antigen B with antibody B. According to this nature of antigen and antibody, blood can be classified into four groups: A, B, AB and O. A person having blood group A has antigen A in RBC and antibody B in plasma, while a person belonging to blood group B has antigen B in RBC and antibody A in plasma. In blood group AB, both antigen A and B are present in RBC, but no antibodies in plasma. The person belonging to blood group O does not have antigen in RBC, but has both antibodies in the serum. Determination of blood group is important in determining the compatibility for blood transfusion and hence is of clinical significance. The Rh factor is another factor present in human blood of about 85% people. A person may therefore be Rh positive or Rh negative. This factor must also be ascertained before the transmission of blood. Normally, no antibodies for this factor is found in the body. Blood is the red body fluid that circulates in our blood vessels, that is, veins and arteries. Blood is a combination of plasma and cells that float in it. It is a specialized body fluid that supplies essential substances and nutrients to our cells and carries waste away from those cells. Blood also contains clotting agents which help prevent excessive loss of blood from the body. It also has a major role in the body's defense against infection. There are many diseases which are associated with blood and its components. There are 4 types of blood group in human depending on its antigen and antibody combination. There is no substitute for blood. It cannot be made or manufactured. Donors are the only source of blood for blood transfusion. Hence, knowledge of one's blood group is very essential.